field and related topics. Okay, so I wanted to talk about what you need to know for like recording your therapy sessions. And I guess a lot of people are doing this and like encouraging each other to do it. And I mean, I don't know because like I only saw it like on one like reel that I saw. So you can definitely do it if you would like. It is something that you should probably run past your therapist. Just I know that like none of my clients have ever really done it. There's like two suspected maybe, but like that's a whole thing. But um, like you probably should run it past your therapist just so that like they know and know why you might want to do it. Like maybe you want to do it because you want to reflect on some of the things that were said, and maybe like sometimes you're like so stressed or anxious about like the whole process that like you're just really not paying attention enough to like go and have this like to really like take in what your therapist is saying. And like I think that it's totally fine. Like I've actually had clients who have gone through that type of stuff where I remember one client came to me like at, I think the next session and was like, I'm just making up like what it was, but I think she said something to the effect of, I think you called me a bad friend. And I said, wait, what? And she was like, I think I got our conversation really mixed up. And I just didn't, I didn't, it just kind of got a little weird in my head. So like, I don't think you said that though. And I was like, oh no, I just said like, you should be like more considerate of their time or something like that. And she was like, okay, that's what I thought you would have said, but like, I don't know, my brain was telling me something different, that like you called me a bad friend to like my friends. And I was like, oh no, no. And like in a situation like that, that would have been fine. Had she had a recording of some sort, like you could definitely get there. You know, there is Irving Yalom. Irving Yalom, I think it's either Irving Yalom or James Hillman. I think is Irving Yalom, who like records his sessions and like sends them or used to send them to his patients, and the patients would like listen to them, or he would listen to them like kind of on his way to wherever, like to his office, and then like he would be able to have conversations with them about like kind of the continuation of the sessions. And like that's perfectly reasonable. Like there are like agreements about that, that you can definitely like exchange and do all of that type of stuff. So like I don't think that there's a problem. The therapist in the reel that I saw said, well, this could be really damaging for some therapists. And I'm like, I don't like, okay. Um, I mean, yeah, no, like, okay. If your therapist is like saying weird shit and doing weird shit, like, I mean, they are ruining their own reputation. I just know that with like my clients, the conversations are so very, very vulnerable that like recording it and then with the intent to put it anywhere would just be um, like them not being authentic or being that vulnerable because they know how it's going to appear, you know? Um, I know early on in my career, there was like so this is New London. There was like the not college station, but the local station that you could like go in, take like a 2 hour, an hour tutorial of like their equipment and then use their equipment. And like I had someone who was like, hey, why don't you just go ahead and like ask them if you can like, do this whole thing and then like find someone who would want to do like almost like public um, sessions just to prove like your theories and all of this other stuff. And I was like, I couldn't find anyone to do it, and it was embarrassing to like ask too. Like I don't, that's just not something that I'd like to do. I mean, think about occasionally, but I'm also like I don't want to do that. um Adding a camera and knowingly adding a camera and an audience to a therapy session is like, eek. Like it's definitely an ick. Like I don't know if that would be actually like a good thing, I like it's not. One of my clients I think may have been recordings. Um, I don't, I can't prove or disprove that. Um, that I don't know. And then there was like someone else who either was trying to record a session or was trying to intimidate me enough to like say that they were recording a session. And it was a person who was not my typical client, and had I known anything more about their background, I would have been like, I can't see this person. They're not like my forte. Like they need a higher form of care. And the it was a teenager. The mom really, really needed parenting like sessions and refused because that's how some parents are. And then you kind of wonder why their kids are, wild. Um, but yeah, like this person was, I mean, upon meeting me, called me ugly, and like, and that's fine, like whatever, okay, sure, like, I was hoping I could like win them over because maybe they were just depressed. They were not just depressed. They had oppositional defiant disorder. I just don't work with people with that, especially not in outpatient. Inpatient, definitely. Like it's almost easier that way because like if you work in a smaller treatment team, you can definitely add consistency that that person needs. But like no, not not the way that it was going in at that time. And so yeah, this person was just absolutely dreadful, unfortunately, and like did not respect adults, which is perfectly fine and understandable, but just not what I work well with. And I think they even asked me to write up their sessions, and I'm um, like the 15 minutes that occasionally you were able to like come for, why? Please tell the other therapist that this is an oppositional defiant person, please, because like you can't just hopefully skate by on like OD, like on depression, and like hope that like the next person can manage them if you're not being honest. So I think that person had recorded possibly, or at least tried to intimidate me, whichever. Okay. um if you think that your therapist is like not appropriate, like either you have to tell them or you have to report them. Like to me there's no question if like there is something that your therapist is doing that is absolutely upsetting you enough that you're like, I actually need to record my sessions. Like there's already a problem. And like, I mean, there are therapists that I'm like, what are your sessions like? Because I want to know. And there's like a couple of things where I think, I don't, okay. So there was a situation. Um, there was a therapist. Yeah, I can say it was in Connecticut. It's public record. It's not like it's not. Sorry, I'm so used to keeping stuff like very private that I'm like, can I say these things? There was a therapist in Connecticut who assaulted two of his patients. I fully believe this happened. I fully believe that he admitted to it, and said something to the effect of to one of them, but you wanted it, and he was recorded because police were involved at that point. Um, and that was used in court. I think the charges were dismissed. I don't remember what happened, but like he was in trouble for that. Like, and that's the type of shit where I'm like, oh my god, why did you even become a therapist if like that? Oh my god, I can't. Oh my god, I can't. But like, yeah, those situations definitely recorded, because that at that point it is, oh my god, I can't. Like it's so terrible. I actually, you shouldn't be in that situation. Oh my god, you shouldn't be in that situation. Like, ugh. But like, I just like, I think that it could be helpful, but you have to kind of have that conversation with your therapist. And if the reason is that you are afraid that like your therapist is doing something that is like really out of pocket, then I mean, I guess record, but I'm also like, record with the intention, like not to post it publicly, but to prove to the board that this therapist is like out of their mind, and you have the proof of that. you know, and yeah, like, but I think that like this therapist who I saw the reel from was like worried that like parts of therapy sessions would end up online and like ruin therapists. And I'm like, what are you guys doing that is like making it seem like you are saying things or doing things that would ruin your reputation, that would be bad for the public to see? Like, I for me, I'm just like, I don't think that my clients want their information out like that. Like, I just I can't I don't like, it's mind-boggling. Like, I don't like I what are therapists doing, man? Like, I don't like what I actually I do know. There are a lot of people who are doing wrong, like no doubt about it. And like I guess people at this point really need to feel like they are able to like have some power in those situations. And like, yeah, you do need to feel like you have power in those situations. Like, I just like, there are definitely taken out of context things that I have said and done in therapy sessions that I'm like, oh, that's oh, I'm glad I have a good like good rapport with my client in order to like, say that. Like, take it out of context. I did tell one of my clients this was a joke. It was so a joke. I want to preference that she knew it was a joke, okay? I told one of my clients being up a sex worker and like set it up as a joke. I set it up just perfectly. And she was like, that was the first time that she had laughed after she had gotten fired. She thanked me so much for that moment. But like, God, can you imagine like that moment taken out of context? Be like, yeah, you did. Like, I did say that, but also that client and I have such a good rapport that like you can't like, it was meant to be funny. It was funny. She's not the type to do that. And like, it was just like, hey, so like your previous job still has like your information available, so you could always become a sex worker. And like, I think because it just was like so, you know just surprising that would say that, like that they just what you call it, yeah, that they just that she had a laugh. It was very nice. It was fine. We had a good moment. And like, we're fine. But like, there's not much that I'm saying in sessions that like anyone would be like, oh my God, you said that. It's like, yeah, there's probably some like tweaks that could be made. But like, I mean, I always ask my clients, do you want to talk about like, what your appetite or, what you've been eating lately? Because I don't want anyone to feel ashamed. I had to delicately talk to one of my clients one time about using protection, especially with like new partners. And I was like very the same vibe where I'm just like, okay, I'm not trying to shame you worth a shit, but please protect yourself. And if you don't want to protect yourself, protect the next person that you might be with, or that like the next partner. Because like the worst thing would be that like you have a infection or disease and you pass that along, and they pass it along because neither of you know if you have anything, like, eek, okay, like, can we, but like all of that stuff, I'm like, I very delicately talk about, like, this is not like I'm going bull into sessions just being like, and another thing, like, oh God, no, 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 no. But I also come at it as the stance of, my clients know themselves best. They live with themselves. I do not know my clients as well as they know themselves. So if at any point, if my client says, Vanessa, that's wrong, I'm like, okay, moving on. Another topic eventually that I'll get to is like the imperfect authority figure, because like some people do have an issue with that and like won't go past those issues. Like, if they're like, Vanessa, that's not me, I don't appreciate you saying that to me, and we move on, like sometimes they don't move on from that point, and it's like 3 months, 6 months, 8 months, a year later, they're still upset at me for things that I might have said back then, even though I've never brought it up again. I respected their boundary, like, so there can be a lot with that. And so like it's a whole thing. I do see that there's a question. So the question is Barbie or Oppenheimer. It was actually Barbie. I fully am aware of like many of the aspects before the bombing, like like that was talked about. I'm like, I can't remember which one was it. Nagasaki, um, like I'm like Big Boy, right? That was the name of the bomb. Like I just did not think that like uh talking about like things that led up to massive death was like something that I really wanted to like delve into, or like yeah, like just I'm nope, that's just not that's not my thing. Also, I hear that it might have been kind of celebratory of like the bombing, which like I also do not want to partake in, because I don't think that that's a good thing, you know, life. So yes, I'm like reiterating as I am like going to sign off soon, that like you can definitely talk to your therapist about if like, you can record sessions for your own reflection. If there's anything that your therapist is doing that is absolutely out of line, like yes, absolutely record so that you can say, like you can send it to the board. I mean, I guess if the board doesn't do anything, then like go public, but like it probably should just be used as like a example of like shit therapists. Like I mean, that's unfortunately there are people who are not great. But I mean, there are things that I guess could be taken out of context that not not great either. But like hopefully it's like if any therapist is watching this, hopefully you're not saying shit like that. That's like, constantly. That was like, oh, do you have to tell your therapist? I mean, I think it's a good like conversation to have with them. I mean, if you feel that they are like if you feel that you have to do this for your own protection and to have evidence for the board that you are reporting them to, then you don't have to. Yeah, I mean, that's yeah. Um, one of those things. Also like HIPAA only like protects clients. It doesn't actually protect therapists. Like it only depends on if you're in a state that has a what is that called, two-person consent. I think a lot of states only have a one-person consent record thing. Like I mean, me as a therapist, I'm like, no, I have a release. Like if I'm going to use anything, and that includes like if my clients draw pictures in their sessions and I post them online with the permission from that thing, that like that release of information, the ROI. So like yeah, like yeah, I mean you don't, I think in most states you don't have to. You would probably have to check with your state on like the recording laws, because like there's things with them, unfortunately. But yeah, if you're not in a state like if you're in a state that requires only one person consenting, you don't have to tell your therapist, especially if you're using it as evidence. And if they are doing stuff like that and you are you are working with the police to record it, then I mean, you're working with the police to record it at that point. I don't know if you have to like say like, hey, I'm recording you because you keep saying shit that I don't appreciate. Thank you. Uh, be like the one session where everything is, hey, that's fine. Hmm. What if your therapist shows up in a bathroom? Oh my god. Oh my god. People are okay. Yeah, they are doing that. I forgot. I can't. Like my colleagues were like, "Oh, I just wear like short shorts, or like what do they say? Like leggings when they do sessions, and I'm like, you don't fully dress like for your sessions? Nope, sit on my bed. Like, ooh, okay. Like, I get dressed for even my like, what, 7, 8 a.m. sessions, like in my home office. Like, I can't, I don't, oof. I would probably have a conversation with my therapist about, eventually, if I felt comfortable, I'd probably have a conversation with them and just be like, hey, so it does bother me that you don't seem like you are prepared or like presenting professionally when we're like talking. So like it would be nice if you could like be fully clothed. Jesus, I have to tell people if they're fully clothed. Oh my god. Oof. Yeah, just yeah, I mean you can say, yeah, you can definitely say like I have a preference and my preference is that like you wear a full shirt. Because that's like as me as a therapist, like one, one of my clients would pee while they were on the session and I was like, could you not do that again? Sorry. He was like, you could tell that I was going pee. I'm like, I could tell that the background changed and I could definitely hear things that were going on. Um, could you not do that again? And I mean, he also had a session while he was drunk. So, you know, times, things, things that you have to talk to your clients about, things that you unfortunately, uncomfortably have to talk to your therapist about. Like, hey, when we have session, could you fully like show up for me? Like that would mean a lot to me. If any of my clients are like, I don't like anything that you wear, I'd probably be like, oh crap, oh, what, how would you like me to dress? I'm also very considerate of everything that I wear for my clients. Like, I remember when I was seeing more people in person, I'd be like, oh, I'm seeing like all of like my male clients today. I don't feel very comfortable in skirts and dresses just in case like that might be like misinterpreted in some way because like it's people things. Um, oh, what else was I gonna say? But yeah, like if I had all like female clients, I'd just be like a little like I'd be more a little bit more likely to like wear leggings sometimes a little bit uncomfortable with them. Um, and then what else? Um, I have rules for myself because like I do want to show up and like be very present for my clients and like not make it seem like anything is that like there's nothing Jesus uh because like therapy I mean on the client side is very intimate because you are talking about like things that you really don't tell anyone else. So like um let's see sorry, I see a question, I'm gonna answer it. Like I just I like the intimacy part of it, like I just like it's a whole different side that like no one except me probably sees. So like that is a whole level that I'm just like, yeah, okay, all right. So your your fiance thought she might have your therapist was hitting on you and acting. I mean, unfortunately, therapists are people, so I wouldn't be surprised if one of them felt that way. Oh gosh, that's so, oh, it's so disgusting. Oh, I'm so sorry you're dealing with that. Are you sure you still want to see that therapist? Oh no. So another person asked what's more comfortable, dealing with male patients or dealing with female patients. So patients that are seen by doctors, I usually see clients. I know that it's not a difference, but it is. Um, so like, sorry, there's something distracting outside the window. Okay. So, I actually like dealing with like male clients a little bit better because I really like just being logic conclusion and having them be like logic conclusion. Okay, no, like I got it, and I okay, And like I often feel like a little bit more like bonded with them, where I'm just like, we're in this together, dude. Like we're gonna go like head on, you know. And like I think also like one of my clients, this was a couple of weeks ago, he was like, I'm fine. And I was like, I feel like I am pushing you and this is very difficult for me. And he was like, I'm fine. And I was like, okay, all right. So this is like complete. He's like, I am completely fine. Like this is not stressing me out like at all in the least bit. And like to me, he came across as like stressed out. And I'm like, I am pushing. I have like I feel this inner wall that I am like crashing against every minute, you know. And he was like, okay, yeah, but I just want to let you know I'm okay. And I'm like, okay, all right. With um, like I don't know, like she's like I'm like, what's the difference? Like I mean I do work with a lot of people of color, and I do work with like a lot of women as well, so it's like it's not like it's just different social environments. And then like when you deal with people who are of like different generations, like there's different things you have to remember about like their history that like isn't always um like apparent to them. um and I also work with a lot of people who are adopted. It's I just happened to like fall into that. Like I worked with a lot of people at both of the they're not residential schools, boarding schools in the New London area. And like it just so happened that it's kind of a lot of them like are adopted. And so I just after like 25 I think like that within like the first I think like 2 or 3 years that I was in private practice, like it became second nature to me to just be like, so you're adopted, okay, all right. So yeah, like it's a whole thing apparently. Okay, let me see. Oh, okay, all right. That is a weird sentence. Okay. um all right. um so let's see. I'm really glad that you did get a new therapist, because that therapist sounds like, I mean, I don't know like that is just, I don't like it. I don't like it. Like I would not advise any of my colleagues to like be like that. Like it just, oh my gosh, like, oh, I wouldn't. Like I mean I did like the whole video where I'm like, I wore a dress that was too tight, but I'm going to something, and everyone's like, that is the most modest dress, and I'm like, I just feel awkward, okay? Like it's just it's a whole thing, and like I have to talk about it, you know, because like I don't think that like, I don't know, like I'm always aware, but like I guess other people aren't, about like how they appear. Yeah, I mean like Jesus, I've really had like the rough go at it. Um, hold on, sorry. What the fuck is going on? Like I've had a really rough go at it with like what you call it? Like, oh, I do have a story about that. Like I've really had a rough go at it with like placements, like places I've worked where they're like, I think I wore like um it wasn't blue jeans, but it looked blue enough that they were like, that's kind of jean like, don't wear that. But I don't know how many times they talked to the woman who was like wearing shirts that when she bent over, like I guess she had a long torso and she could have worn a shirt like this that like covers everything and like is longer. Let me stand up for a second. Like that is longer. Like look how long this shirt is. Like it is long. It goes all the way down. Like if I, you know, like there's nothing that's showing. But like she did not wear stuff that hid everything, so she just didn't. Like I don't know why she wasn't written up like or talked to about that, because that just seemed like a distraction and terrible. But like yeah, she didn't care. I mean, it's probably why she didn't change, because she didn't care. Um, so worst experience as a therapist. One of my clients came to an open house that I was having, and like they which we'll call it he wanted to have like a free session. And like I was not about that. And I was like, I know that like this is more of an open house for like other people to like come and like talk, and like learn about my style and everything. So he left, and after that, I think he called me a cheap whore or something like that. There might have been an email or something, phone call, something where he called me a cheap whore, and I was like, "We're you, you're you're discharged as a client. Like, I don't feel comfortable with you anymore." And I knew he had a treatment team who I did have permission to talk to, and I was like, "This is what this patient told me that, or this is patient. This is what this patient told me. I'm not responding to any more emails, anything." Um, and he did send me a letter, like let's say like a month after, and was like, "You better apologize to me." And I was like, "Yeah." So I like I was like, this is, I don't feel comfortable with you. He was also the patient. Um, there's a whole lot to this. He was also the patient who told me he loved me like a lot. Like he'd be like, "Oh yeah, I'm in love with you," and I'd be like, "Oh, okay, that's okay." And my supervisor at the time wanted me to ask him, "Why do you feel so comfortable saying that?" And I was like, "Oh no, I don't think that you understand the female experience enough to understand how absolutely uncomfortable this is, and like how I do not like this. And I do not want to have conversations about it either. Like, could I just like not?" And so yeah, we just didn't know. We just didn't. And that was fine. That was fine. you know like I'm so glad that like person, they didn't, that yeah, they kind of ruined themselves, I guess, or like they were ready for the next therapist at that point. And yeah, like New London is a very small community. There was a mutual friend of ours who clearly knew that he was a client of mine, and she was like, "You got to talk to him." And I was like, "Please, I hate all of this. Please don't." Oh my gosh, I'm so glad I'm out of New London. Oh, there was just so much going on there. Anyway, I have a client. I'm really glad that all of you showed up. That means a lot to me that there was interaction, because I never know like if I'm just screaming into a void. So like, yay, I'm not screaming into a void. And I will talk with you hopefully soon. All right, have a good one. Bye.